Hello everyone, my name is Rena, and today I'll be talking to you about narcolepsy. Narcolepsy is defined as a REM sleeping disorder. It is the inability of an individual to regulate their own sleep-wake cycles. And what would that imply? Patients who are not narcoleptic are consciously able to keep themselves awake during the day and reserve sleeping for nap time or even all the way until bedtime. However, narcoleptic patients have a large difficulty with staying awake during the day and are in a constant state of fighting sleepiness. This does not mean that things as simple as falling asleep in class or the microsleep that some truck drivers get into during a long shift are considered to be narcolepsy. Narcoleptic patients chronically struggle with a severe feeling of sleepiness during the day, and it is not to be confused with idiopathic hypersomnia, which is a consistent feeling of sleepiness during the day even after an adequate night's rest. It is said that only 0.02 to 0.18% of the population suffer from narcolepsy. But according to Ohio et al., those figures show a severe underdiagnosis of the disorder in the general population. The study that they carried out in Europe found that almost 2% of the population suffered from a plethora of narcolepsy-related symptoms. Another study carried out by Wandel et al. Showed that demographic differences changed the rate of diagnosis of narcolepsy and also changed the likelihood of the type of narcolepsy people were likely to suffer from. Additionally, unlike things like insomnia and other sleeping disorders, males have a higher chance of developing narcolepsy with a ratio of 1.6 to 1 male to female. Patients are more likely to develop narcoleptic symptoms during two times in their life. Number 1, during mid-adolescence, which is between the ages of 14 and 16, or in their mid-30s, which is between the ages of 34 and 36. But 50% of cases occur during adolescence. An area in the brain called the lateral hypothalamus contains orexin neurons. Those are thought to be responsible for stabilizing sleep and wake cycles. Those neurons release neurotransmitters called hypocretin 1 and 2, which are the neurotransmitters responsible for communicating with the reticular activating system, another system that is essential to sleep and wake cycles. With that being said, narcolepsy usually occurs when there is a severe degradation of orexin neurons in the hypothalamus. Science believes that this is due to streptococcal infections that people may have contracted in their younger years. It is said that during the fight against the infection, the body starts to fight its own orexin neurons. This will eventually cause 1, the obliteration, or 2, a severe lack of hypocretin transmitters for sleep regulation. A study done in Mali by Pace et al. Shows a strong correlation between degradation of orexin neurons and streptococcal infection. Their patient had contracted it in her younger years and now suffers from the most severe kind of narcolepsy. There are certain factors that make people of higher risk to develop narcolepsy. Number 1 would be the presence of the human glycogen antigen, which is more scientifically known as HLA-DQB1-0602 or HLA-DQA1-0602. And there's also the presence of narcolepsy in a close family member, so a mom, a dad, a brother, or sister. Another risk factor is an injury to the head, especially to the hypothalamus, and even things like a stroke. There are 6 main symptoms to narcolepsy. Number 1 is excessive daytime sleepiness. This is defined as the uncontrollable urge to fall asleep during the daytime. Usually when patients do fall asleep, they will fall directly into REM sleep, which is not normal. The second symptom would be cataplexy. Usually if a patient has cataplexy, they would automatically be diagnosed with narcolepsy even without the presence of any other symptom. Cataplexy can be defined as muscle paralysis during the day. This can last between anywhere from a couple seconds to a couple minutes. The third would be sleep paralysis, which is due to prolonged or early onset atonia. During this paralysis, patients will usually say that they experience hallucinations. These hallucinations are visual and tactile and can be described as lucid dreaming. The fourth symptom would be fragmented sleep or insomnia. Although patients have a very easy time falling asleep during the day, they may still experience fragmented sleep during the nighttime because they still have a 24-hour circadian rhythm. The fifth symptom is usually attributed to children, but that would be the presence of hyperactivity. And then the sixth symptom would be nocturnal maladaptive behavior, which can be eating or hunger during the nighttime. There are 4 steps that go into the diagnosing. Number 1, the polysomnogram. Number 2, multiple sleep latency tests. Number 4, checking if the person meets with the DSM-5 criteria. And number 4 would be exclusion, which is checking to see if the patient has sufficient hypocretin in their system or if they have the presence of the HLA gene. There are typically 2 types of narcolepsy. Type 1 would be cataplectic narcolepsy, which is the presence of cataplexy, and type 2, non-cataplectic, which patients with narcolepsy will not have cataplexy but will exhibit most of the other symptoms. There are medical treatments that have been developed to try and help combat symptoms of narcolepsy, but there is still no cure. Methylphenidate is the leading cure for narcolepsy and it promotes daytime wakefulness. Other medications like sodium oxybate will try and inhibit the symptoms of cataplexy. However, the patients that use these medications can see a significant decrease in their symptoms, but it does not stop them from coming up from time to time. The second category of treatments would be non-pharmacologic treatments that include things like a regular sleeping cycle, napping, avoiding certain foods, avoiding certain activities, exercising, and support from their peers. Narcolepsy has a significant impact on people's lives. It can hinder their grades, hinder their job performances, and cause them severe anxiety when thinking of cataplectic reactions happening when engaging in social activities. It could also be very, very hazardous because people with narcolepsy could fall asleep doing simple things like driving or swimming. I hope you were able to learn a lot from this video. Thank you for watching.